This improved immune response is expected to better protect against the strains that are circulating in our communities.
Did I hit a time machine and go back to 2020? Hi, I'm Brian Lilley, political columnist with the Toronto Sun. That video might look like it comes from the height of the early stages of the pandemic, when everyone was masking up, when everyone was talking about making sure that you got your vaccine that was just being rolled out. But no, that's from September 2023. Dr. Tam, Canada's Chief Medical Officer of Health, and every other doctor on the stage there wearing a mask for a news conference indoors while they're sitting far apart from each other. They're back to social distancing. They're back to masking. Why on earth are we heading in this direction again? Well, Dr. Tam made her case for why she's doing that.
From the start of 2023, COVID-19 indicators have been on a decline to historically low levels for a number of months. In the last few weeks, we have started to see an increase in COVID-19 indicators across many areas of the country, including hospitalizations.
Well, let's give you some of the actual numbers, because in the most recent numbers for Ontario, updated to September 2nd, there were 1,500 cases confirmed across the province. There were 70 people admitted to hospital with, not necessarily for, COVID-19, and there were 10 people who died with, not necessarily from, COVID-19. These are hardly numbers that need to start seeing us go back to March 2020 or later restrictions. But Dr. Tam actually made an appeal for everyone to start wearing masks indoors again. This doesn't make sense. It didn't make sense during the height of the pandemic, and it doesn't make sense now with what we know. Dr. Sean Watley, a man who has run emergency rooms, been an associate or adjunct professor of medicine at McMaster University, who has an extensive medical career, writing in National Post the other day, detailed why bringing back masking policies and mandates makes no sense. He cited the World Health Organization's own research into this. He cited a Cochrane review published in January showing little evidence to support masking, and a London hospital in the United Kingdom at the height of Omicron finding that there was no difference in transmission rates with or without mask mandates. So why is this happening? Well, Dr. Watley quotes Dr. Martha Fulford, an epidemiologist and infectious disease specialist for Hamilton, Ontario, who says this is happening because the hospitals don't know what else to do and they want to be seen as doing something. But Dr. Tam isn't just talking about masking in hospitals or around vulnerable people, which maybe I can understand even just as a courtesy doing. She's talking about masking up in your workplace, in your schools, masking up in your daily life, going about the streets, in public transit. And I'm just frankly not going to do it. As for whether you get another booster or another shot, they're now saying this is not a booster. It's like the flu shot. It's something you get every year. That's up to you. That's something that you should speak to your doctor or primary healthcare provider about. Whether you want to do it, whether you decide to do it, that is and should be your choice, just like the flu shot every year. But just like we didn't mask up for the flu every year pre-COVID, we don't need to be masking up for COVID coming back in the fall. This is not something that we should accept as being normalized, but that's what Dr. Tam and others want us to do. Are you going to start wearing a mask again? Are you going to start socially distancing from people again? Are you going back to the depths of the pandemic where people asked to be locked down? I'm not. Let me know what you think. Drop a comment down below. Share this on social media. And don't forget to subscribe to our channel.